the story. And this is Anson over here. He's 4 years and 3 months.
Yes.
And can you tell me a brief about his history in the sense that how did you find out that there was something wrong about that
Um,
things didn't match up, the development delays and all of these things? When did you start noticing it?
before 6 months, he was that time it was COVID.
Hmm.
We cannot go anywhere and ask what is the problem with.
Hmm.
After we observe him, after 6 months, he's not turning.
Huh.
He's not holding his neck.
Hmm. Not
That
sitting.
not sitting like that. After we asked with doctor also, doctor said no. It's like normal. He will be normal. Is
Sometimes they say it will come
delay.
later. Okay.
Development delay.
Hmm.
After 1 year, it's not change only. He is doing
Hmm.
same movement.
Hmm.
After we 1 year, 1 year after we went to ask the 1.5 years.
Hmm.
He was normally
Hmm.
1 year and 7 months.
Hmm.
He went. We asked doctor said, "You want to be therapy like that?
Hmm.
You want to do?"
Hmm.
We started therapy also.
Hmm.
There is no improvement only.
There was no
No improvement.
Okay.
He was normally every time he's crying. He's like tightness is becoming more.
So there was also, I would say, spasticity was there a lot more in the earlier time.
Yes.
Not more.
Yes, that.
It's
Was
not.
the body more spastic, like hypotonic?
Yes, yes.
Yeah,
Yeah.
in the start.
Yes.
And then
Till
when
start.
the body loosened up, was there more involuntary movement?
Is surrounding like all the body is turning.
Okay,
We cannot
shaking.
like you cannot control his body. If we pick up him, he will be like not
Okay.
like a normal child who stay. Is holding and is like
most of this shaking.
shaking.
Okay.
Everyone will not take him. So afraid of
Holding
to him.
Right.
Why he is doing like this?
Hmm.
After after 3.5 after we
2.5 years.
went
Yeah.
to
Only
online.
then you found out. So did the doctor, were they able to diagnose anything? Because I haven't seen any of the doctor's notes.
No, doctor says nothing. He has
They said
only
only
to therapy.
do physiotherapy.
But no, they did not diagnose anything
no.
for
No,
him at
nothing.
all. So
They
that
make
must have
one.
been very difficult for you guys because I know that your MRI and your EEG, everything is normal.
They are giving different medicines. He has different types. We cannot control only him. Without
So it became worse rather
worst.
than getting better.
If we not give the medicine, he will be normal. He will be a normal child, like normal how he's like that.
No shakes.
No shakes.
Extreme shakes that you saw. Yeah.
Normal is like if we start the medicine, we didn't start any all the medicine like what they say.
That given, right.
If we give for 5 days, he will be like cannot control only.
Okay.
After I stopped that,
Okay.
after I started your online like that, is like becoming improvements. He had a improvement.
So when we talk about obviously being misdiagnosed, or I would say having no diagnosis at
he
all.
has a motion problem. First of all, that is a big problem for
Constipation?
is very hard, like a goats.
Yes.
He had.
Yeah.
After you show me the treatment, he was normal. I was very.
That was because he had a hypotonic stomach. So the muscles around that area, the stomach, was very tight. Right? So when the muscles in this area is like wood or iron, we can't have movement. So it must have been very difficult for him to pass the stool. right?
Mm.
So the way I was looking at his stomach and everything, I could see that there is a lot of, because the rib
It's becoming
cage, yeah,
like this.
the rib cage was down and the stomach area was only small, right? When you came
Yes,
Yeah,
yes,
yeah,
yesterday,
understood.
day before yesterday when you came, the stomach was very small
yes.
and this area was quite
Like
Big.
and broad,
broad, like that.
right?
I was asking with doctor also why
Yeah.
he's like that. They said it's like he's not becoming. Or,
It's not
uh,
extending or it's not really growth.
yeah.
The growth is not there. So see, this is where I would urge every doctor or every neuro doctor which is there to, at least if you're giving medications, I would urge to at least let the parents know that what is wrong with the child, because when they understand what is happening, they will be able to cope with it better. If we don't explain the parents what is actually happening to their child, they don't know how to handle the child or whether to how to look after them. As a doctor, we have a responsibility towards the patient who's trusting us and they're coming to us to understand what is wrong with their child. And they look at the doctors as the people who will be able to help them out. So when we don't tell them what is wrong with the child, why would you give medication? I don't understand. That is one thing. So if you don't know diagnosis and then given you five, six medications, it does not make
They
sense.
didn't start all the one time. They will give one medicine. If we are saying we cannot give this, they will change. It will be like that. After I stopped the all the medicines, I only
Yeah, because you didn't know what you were dealing with,
Mm.
right? So say if I say to you that you have a problem with your stomach, right? Or your digestion is very weak, you feel acidic or whatever. So I will tell you, okay, you may have some form of disorder in your stomach. So please take this. I think it's sleepy. Please take this medication. It will help with your stomach. So what happens is that your dedication towards the medicine increases. Does that make sense? Because you
yeah.
know what it is helping. But if somebody says, "Oh, take this,"
Yeah, that's
yeah, you will take it for one day, thinking, "Okay, I'll take it 2 days." But your dedication is not there because yet he hasn't told you or she hasn't told you what is wrong
Yes.
and why you're taking that medication. So this is very important to understand, and always take out time with your doctor and always go to a doctor who has time for you.
Yes.
Because when you are taking these medications are very strong medications
Yeah.
and they have hundreds of side effects.
Mm.
And you need to decide whether those side effects are greater than the issue which you have in hand. Because sometimes the issues are smaller and the side effects makes it worse.
no, worst.
Right? So that is something that I would advise to every parent is to ask first and then do your Google search or do your
No, I
searches.
asked doctor. If
Ah,
I said doctor is doing like this, they says one day it will be not change because
it will take time.
it will take time. I said we cannot control him because he's every time near
Movement.
the house. They are asking why he's crying. He's
Mm.
not like that.
Mm.
I said I don't know why he's
Because
crying.
of the
Medicine,
medicine.
and he sometimes he's slow sleepy. Every
Mm.
24 hours he will be sleep
Mm.
is not moments we will see like uh,
Yeah.
it's uh,
Yeah.
we will afraid
It's a
because
scary, yes.
uh, why he's doing like that if is they change the medicine he will be very activity he's crying every time
Mm.
uh, I was thinking why he's doing we want some changes
It's frustrating, absolutely. Because what is happening is that, see, what I have seen in him from yesterday is that he has certain issues with the nervous system. Now that is coming from the spinal fluid, the whatever the nervous system is, the nerves coming out of the spine area.
Yeah.
The fluids are not reaching
Mhm.
the
Yes.
brain. Now, the muscle area, whatever treatment we gave yesterday, it has helped with the muscle tone.
Mhm.
Okay, so what you see regulatory with him today is that he's able to sit straight. Where the neck was hyperextended, it is much more better now.
Much
He's
more,
able to
yes.
move it in front.
Friend, yeah.
Whereas when you came yesterday, it felt
It's
like
like,
his body was stuck like that.
Mhm.
So those changes have come, but the balance part where he needs to hold things and be accurate into it, that comes into cerebellum area. So according to what activities I saw in him and what changes I brought in him, I figured out that there is an injury in his cerebellum area.
Mm.
Okay, that area is dependent. What happens with that area is that it communicates with the muscles. It balances. It's also with the eyes. So all of that thing I can see that his eyes also roll as his
From
neck roll, right? So that's where
on
that
sleep ಮಾಡಿ.
yeah. So that is where it is the damage. Otherwise, he would have got the full neck control and body control with the treatment that I gave. Okay. However, saying that, I think we have almost how many changes? We have had 15 changes.
Yeah.
Yeah, which is a good thing. I think. Why don't you say what are the changes? I think,
His neck holding,
yeah.
Much more
and
improved.
his
Neck holding.
hand holding,
And
and
concentration on this playing toys and mingle with others like that. Then
before he has
like
many
to-
people, he will be like
Yes.
like now he's okay, he's better now.
His interaction is much better.
Yes, yes.
Definitely.
And then try to
Motions
stand, try to walk.
Time to stand and walk. Yes.
Yes.
and motions.
Motion. Yes.
Yes.
That was your
Big
big
Motioning
problem
is
for
good,
you,
yes.
right?
And
And
and,
toys. He started playing with
toys he's
Yes.
trying it was
like to hold the toys, try to hold the hold
Yeah.
with the not full hand. Try to hold with the 2 3 fingers, 4 fingers like that,
Yes.
and playing with toys sometimes.
Plays with toys
and
sometimes.
Yeah.
sound also. He cannot hear the loud sound.
Now
He's
able-
okay, he's
now
better
he's
now.
Okay.
able to
Any
hear
loud
the
sound, no problem.
And what about the vision, eye contact, and everything? How
That
was
was before also same.
it was there?
Good.
So
Same.
there was no problem with the
The
eyes,
eye
but the
contact.
hearing was the problem.
Yeah.
That the
Here,
high pitched noise he did not hear, but now he's able to.
he's
hear.
okay.
Okay. What about words? Has he started?
He started to call Dada.
Mm.
In our language, Aji, like that.
Mm.
Some words he says, but
Some words to
we
speaking.
cannot
Understand.
The
He's
clarity.
speaking
before
with us
before
every
he's
time.
only
Mm.
that.
Mm.
Now he's taking some words
Sounds,
e.
Mm.
If we say some songs as Papa, his last words he will be ha ha ha. He will be like that. He can understand.
He's understanding everything now.
He is sleeping also.
Huh?
Mm.
So I also saw something that he is able to respond. So if I'm commanding something to him,
Yes.
he is able to
Yeah.
do those actions. Like when he was putting his neck down, I said, bring it
Wake
up.
up.
So
Yeah.
he picked up his neck.
Mm.
So that is also something good. And then he understands when I'm saying it with loud
Mm.
volume, then he's like,
Mm.
so he's understanding those emotions as well, which is a very good thing. Right?
Yes.
Am I right?
Yes,
Neck
Papa.
straight, neck
Yes.
straight. Well done. Well done. Mouth close. Close your mouth.
That's good.
Oh, close your mouth. How do you close your mouth? Up. Do that.
Mm.
Very good. Very
Yes,
Such
good.
a show.
Mm.
And also, did we say that there is also like the sitting posture, like yesterday?
Yesterday, before it's like
Curve.
curved. Now it's become straight.
Straight.
It's okay. It's fine. It's
And he's
before,
also
and he's
balancing.
he's sitting like this.
Yeah,
One
before he
side,
was
Ah.
like going on one side.
one side,
Now he's sitting more in the
straight,
A
center.
little
center.
better now.
Mm.
Midline
Ah,
balance is
Mm.
better.
Mm.
And what about the gripping and all of those things?
grip.
Now is much better.
Much better than before, where
Before,
it was
yes.
in that.
Mm.
Straight, neck straight,
Mm.
bring
Straight
the neck.
answer.
Well done, well done.
Before he's not sitting like this. Also, he's pushing like this.
Yeah,
He
could
cannot
not
sit.
sit, yes.
If
Now
we
it's
all
like he's not even moving. There was a lot of movement
Yes, a
before,
moment.
right?
Yes, yes.
And also the best part that I saw yesterday was after we finished the therapy, the session, his stomach has become longer,
yeah,
right?
yeah.
And the rib has become much,
Uh,
it's come to its own
all
place.
place.
So now you can feel like he's smaller
Yes.
on the top. Before
Yeah.
it felt
It's
like
like
he had
a
open,
big.
yeah, like
Open,
the
yeah.
I
chest
was
was
also saying
open.
every child I will see why he's like this.
Yeah,
Because he's like this. It might becoming it's
smaller,
smaller.
yeah.
I was thinking what happened for his stomach has a problem or something.
Uh-huh.
Now
No,
he's
that was,
better.
yes, now is definitely better, and I can see that he does not even have like the fear of sound,
Mm.
which you said
But
during the consultation.
yeah.
Yeah,
He has suddenly it's coming sound. He will be like
yeah,
that.
but that would be me and
Afraid.
you
Yeah,
as
yeah.
Afraid,
but
yes.
That
but
is not
uh,
something wrong. It's just
it's
when
like
somebody is like, just say if I move something like that, or if I drop the pen, suddenly if he does that, that is not right.
okay.
But if there is sudden, like say pressure cooker noise comes,
Before
me,
yeah,
you,
yeah.
we all will
Like that.
start
No,
off.
before he has also when the cooker was whistling, he will be afraid and he will be crying. Now he's better.
Now
He's
it's
Now
okay.
he's
Now
able
not,
to
yeah,
go.
yeah.
no crying.
Now he knows that his food is
It's good.
getting made. And also you said that he was not able to swallow any.
Eating also. That's a big because every time sometime we are going far away to a tour or something. I was thinking what to give him. Every time we want to give a liquid only. What we cannot take. If we eat something is better. Now 6 months. Last time you showed before the exercise that I gave him. He was like, but not properly. But is he
Trying
try
to
to
eat.
eat.
Trying to eat.
Before I
Trying to
give
swelling.
him, before he will be vomiting all what I gave. Now he's
Now
better. He's better.
No, that is definitely, I have seen like from yesterday to today as well. I have seen even the noise that was coming.
Yes,
That
yes.
is not regular noise.
Yeah.
Whereas yesterday you said to me that noise doesn't stop.
That's the better.
Yeah, look at now, there is no noise.
Malagisi.
I think he's sleeping. He's trying to show off. Are you trying to show off?
No, he's sleeping.
He's like, it's all about me. So I should be, yeah. And another thing, always remember, if your child is resting the tongue and it's not touching the top of the mouth over here, it means that they must have some form of muscular disorder. So always try and look if the tongue is touching the top of the mouth, that means that his swallowing is better, right? So yesterday you also noticed that the tongue was loose, so
Yes,
all the drooling was happening, and then today the tongue is up.
And when
also the
he's
swallowing is good,
sleeping time, is every time is open. Now it's better now.
So look, Hanson, what happened? And also the social smile, right? It's all about you, Hanson.
Answer.
What happened?
Oh,
No, it's okay.
my God. All right. Okay. So, I hope that you're happy with whatever results we have got so far. But like I said, this is not a small injury. This is something where, because it is in the area of the nervous system, We need to work on the muscular abilities. We need to strengthen the muscles, but also we need to work on the cerebellum area. So that is the session that I have already taught you what you need to do. And secondly, always remember that the diet is of utmost importance. If you are eating something, doesn't mean that it is suitable for the child, because your digestive system is not affected as much as the child. Okay, so when the child's digestive system is not working, you cannot give rice because rice has starch, very heavy starch. Okay, so when you're giving rice, that's why he was vomiting before. Okay, so when you're giving something with heavy starch, because children normally what happens is that whether you get cerelac, whether you get any of these children food, they have high amount of sugar, right? So again, that is supposed to be glucose, but the child is still not able to digest that sugar. Carbs, they're not able to digest. So I would suggest is simple things, try simple things like sattu. You know the gram, the yellow gram.
Yes.
You know the one that we normally give it to the horses for running races and things like that. There's we call it chana,
Ah.
but not the dal chana.
Okay.
The one that you can eat it.
Yes. That one.
Kadlena.
Yeah. So what you do is you grind it and you make a powder of that. And then when you're traveling, you can take it with you. Okay. So any parent who's not taking my diet and they feel, oh, how do I travel if I don't carry Cerelac and all those things? But these things are available which your parents used to give it to you. Or our parents would never go to get Cerelac, right? So they used to have this homemade recipes that were given to their children, and we all grew up well. I mean, I don't see we all lack Cerelac, right? We are all healthy. So don't give things to your children that has a lot of preservatives, especially if their stomach there is this stomach reflux. Okay, so always give lighter food and give much more. No fruits during that time. No apple, like you said, the
Yeah,
apple was
apple
not suited.
cannot give.
Yeah, so no apples, no nothing sour. Okay, and also no carbs. Only give protein a little bit so that they can sustain itself, right? So all of these things, if you look at it, he's got 15 changes in him, and we are expecting even more. And then in 3 months, I'm going to keep up to date with what's happening with Anson. And I think there are still brilliant changes compared to what you've gone through.
Yes.
So I wish you all the best.
Thank
And
you.
then next time, I'm sure you're going to follow all the instructions
Okay,
I've told you.
sure.
And another thing I want to add, one thing very seriously, is mothers, please, and fathers as well, please look after yourself, because you are the roots. If the root is not strong, the tree will be unhealthy. Okay, so if you don't look after yourself, and if something goes wrong with you, or if something you're not able to take care of your child, who will? Am I right?
Yes.
So one thing I have told every parent, and I repeat it again and again, please look after yourselves. Take care of your diet. Take care of your exercises. Take care. Do some breathing exercises, and always be positive. Thank you so much.
Yes.